So welcome everyone to our webinar. We are also live on Facebook. We were giving a few minutes because people are still joining us. So we thank already all the participants who are online. There's more than 50 of you already. And we have some messages about others who are actually joining us right now. So if it's already 2:05, so we're going to start, and then the others will catch us up. So my name is Olivia Ngou. I'm with the NGO called Impact Santé Afrique. I'm very happy because we have an amazing team of speakers, women speakers and leaders in this field. So I'm very happy to introduce you to Mrs. Sophie Dimitris. Sophie has worked for more than 2 decades in pioneering grassroots work and top-level policy developing focused women and young people programs. She's also an advocate around integration of sexual and reproductive rights in health and with HIV. And Sophie has been living with HIV for 26 years, and she's the global coordinator of Women for Global Fund that we will invite you to check and Google. You also have the website, Women for Global Funds, which is a global movement to make the Global Fund responsive and accountable to the needs of women living and affected by HIV, TB, and malaria. So we are happy to have Sophie with us. And we also have Katia Burns. Katia is an independent consultant working on gender, malaria, TB, and HIV. She's based in the US and India, and Katia works globally for UN agencies, NGOs, bilateral development partners, and she has served a total of 7 years on the GRP. So great. It's actually a good year because countries are developing the malaria concept notes. So it's very important to hear from GRP members and also the experience to improve on the concept note. So Carrie, then we have Carrie Madison. Carrie is a project manager with over 10 years of experience in health and development. She's passionate about strengthening community system and making services more accessible for women and children and in hard-to-reach area. She has implemented malaria control programs in challenging environments, and Carrie currently serves on the GRP. So thank you very much, Carrie, for your time. And I'm sure we do have a lot of representatives from CCM members, malaria control programs, civil society, who are eager to hear from a GRP member as well on the topic. Last but not least, we have our Olive Mumba that everybody probably knows already. So Olive is the Executive Chief Director of the Eastern Africa National Networks of AIDS and Health Services organization called ENIASO. She has 19 experience working directly with civil society and community group in the area of HIV, TB, and malaria in East Africa and Anglophone Africa. And she's a regional and global health activist. Most of her work spent around influencing health policy, legislation, programming, health financing, promoting community system, human rights, gender equality, and strengthening the engagement of civil society and community to contribute effectively in decision-making and service delivery platforms on health. So Olivia sits on several boards. She's also the part of the Developing Country NGOs delegation to the Stop TB board, CISPAN, GFAN, and we are very happy to have Olive, which also represents the community right and gender Anglophone platform of the Global Fund. So as you know, we have amazing speakers. We are going to get into the presentations now. We'll start with a little introduction. Then we'll have Mrs. Sophie who will make a presentation about gender and malaria. And then we have Katia and Kerry will give some tip and advice from TRPs on the malaria concept note. And then Olive is going to end the presentation and go over what civil society can do also around those issues and how to integrate these issues in the program. So we're going to start with just a short introductions video, and then Sophie is going to do the first presentation. So welcome everyone who joined us. I'm Olivia, and we're very happy to have you. And we are going to have a good time. Feel free, please, each participant, to write your question in the Q&A session, the little box that you see on your screen. And please indicate which speaker or presenter or which presentations your question is referring to. And we'll have a session of Q&A at the end of our webinar. So welcome again, and we hope to have a very productive time with you all. So thank you, and thank you, Sophie, and the mic is to you. Thank you.
Thanks, Olivia. Can everyone see my slides? Good.
Yes, very well.
Great. So thank you for inviting me to speak this afternoon. In this presentation, I'm going to speak to two key areas. The first is what you need to know around gender, equality, equity, and sexual orientation, gender identity, and why this is important to all of us. And the second area is what the Global Fund strategy, policy, and processes advise us on all of this. So this is a really important webinar. Whilst we know that all people are exposed to malaria and can be affected, the risks of exposure and limitations to accessing adequate prevention and treatment remain disproportionately high amongst women, and unequal gender roles and gender dynamics give rise to different vulnerabilities. A combination of biological, socioeconomic, and cultural factors increase susceptibility amongst women, especially adolescent girls between 15 to 19 years of age, women living with HIV, pregnant women, and women from key populations. So we know about 70% of malaria deaths amongst pregnant women and children under 5. So 70% of deaths account for those populations. So this is just one slide on Women for Global Fund. For those of you who don't know us, we are a network that was born out of a review that was done in 2012, the history of which is available on our website. So on the left of the slide, I'm just going to give you a bit of background about who we are. The review showed that the Global Fund's gender equality strategy, which was created in 2008, was not being implemented well, and there was a real lack of understanding around what gender and gender transformative programming meant. We also saw that women and gender champions were not engaged with the Global Fund. They were fairly unorganized and only following the policy dialogue at the global level over at UNAIDS, and they didn't really understand the entry points to influence the Global Fund. The review found some excellent gender projects, but none of them were happening at the right scale to address the needs and rights of women and girls, or even just to meet their priority needs. we could see that much more was required to move beyond PMTCT as the panacea of gender programming to ensure that Global Fund strategies, policies, and processes started to really address gender inequality. And finally, no one was supporting women or advocating around having a gender lens in a substantial way. So we now have an active network of women who are engaged in countries. And over on the left of the slide, you will see the core areas of work which we have, which are around, first one is very much focusing on ensuring that Global Fund policy processes really do focus on inequalities, on gender inequality. The second is around bringing women together to learn from each other, to strategize together, and to organize our advocacy. And the third area is around securing accountability and critiquing Global Fund programs. So I wanted to start with, what does gender mean and why does it matter? So gender refers to socially constructed characteristics of women and men. And it's something we all learn through our own social structures, our own social norms, roles, and relationships of and between groups of women and men. So to say it another way, gender is used to describe the characteristics of women and men, and it's socially constructed. So people are born male or female, but they learn to be girls and boys, and they learn to grow into women and men. And sometimes people have a gender that blends elements of being a man or a woman. And sometimes people don't identify with any gender. Some people's genders change over time. And so we think of gender as something that's static, but it's actually not. So people whose gender is not male or female use many different terms to describe themselves. And non-binary is one of the most common terms that are used these days. So a significant barrier to creating a fully inclusive world is the presumption that sex, gender, and sexual orientation fit nicely into a binary model, which is populated by boys and girls who are viewed as polar opposites. And this world that we live in conflates biology, gender expression, gender identity, and sexual orientation, relegating people, so putting people in these little boxes of you're either male or you're female or you're straight or you're gay. But we know that in reality, it's much more fluid. So gender relations are the ways in which our culture or society define rights, responsibilities, and the identity of men and women and non-binary people in relation to one another. So when individuals or groups do not fit into an established gender norm, they often face stigma, discrimination, and social exclusion, all of which adversely affects our health. So if we look at this slide, there's lots of different terms that we use. And despite the gains to increase prevention efforts, the malaria response has really failed to delineate and disaggregate data, showing a clear picture of how men and women and non-binary people across their life course are differently impacted by malaria. So I'm going to start with our sex, the star here. And for many people, a person's gender identity is consistent with their biology, the biological sex assigned to them when they are born. So they are either born male or female, and they feel male or female. And some people who were assigned male or female at birth choose to express different gender identities later on in life. So someone assigned male at birth may or may not later identify as a boy or a man, and someone assigned female at birth may or may not later identify as a girl or a woman. So that's about your biological sex. Your identity is, as we said before, it's a social construct, and it's an individual's deeply held sense of being male, female, or another gender. And this can be completely separate to the sex that you are assigned at birth. Let's look at gender expression, which is, the whole of you. So gender identity is internal, whereas gender expression is how a person publicly expresses their gender. And this can include how we dress, how we wear our hair, how we use makeup, our body language, our voice. It can be our chosen name. It can be the pronouns we use as a way to express our gender. So someone may identify as a woman and dress in a traditionally feminine way, whereas another woman may identify as a woman and dress in a traditionally masculine way. Another may identify as neither a man nor a woman and playfully incorporate traditionally masculine and feminine elements in how they present themselves. Societal expectations of gender expression are reinforced in many aspects of our life. So if I look at, my 8-year-old son, even without me having to correct him, he has very clear ideas about what toys are for boys, what colors boys like and shouldn't like, the clothes he should be wearing as a boy, the games he should be playing. And often as adults, we can either reinforce these stereotypes or we can choose to show our kids another reality, something that's more diverse and fluid. So sexual orientation or attraction refers to a person's emotional and or sexual attraction to other people. Sexuality is also something very complex, and attraction can manifest in many different forms for many different people. So these are some of the important areas around gender that we have to think about when we're creating programs for people in our communities. I wanted to also touch on this gender equality continuum tool. So this framework categorizes approaches by how we can respond to gender norms and inequities and inequalities in our communities. And so this takes the user, if you were looking at a program in your community, from gender blind to gender aware, which is where we would like to be. So a gender blind or gender negative or neutral intervention actually aggravates or reinforces existing gender inequalities and norms because it doesn't acknowledge the different gender needs and realities of women and men or non-binary people. So it just doesn't actually even acknowledge it. You can't see it when you're reading a program or you're doing an evaluation. There's nothing that tells you how the program is responding differently to the needs of men and women. On the other hand, gender-aware programs, policies deliberately examine and address the anticipated and the existing gender-related outcomes during both design and implementation. So an important prerequisite for gender-interrogated interventions is to be more gender-aware. Let me start with this exploitative on this end. So if I were to give you an example of this, I would take program of women living with HIV. And most of women who are accessing treatment, they're doing it because they're pregnant and they needed to go into the healthcare service because of their pregnancy. And so that, in many countries right now, we have a policy that says that pregnant women have to have an HIV test. It's law. So that is a policy and a law that's exploitative, because it knows that women are going to have to come in to access healthcare because of their pregnancy. A gender accommodating or a gender sensitive intervention takes into account the differences and attempts to ensure that women will benefit from the intervention. And gender transformative interventions explicitly seek to redefine and transform gender norms, creating equitable gender norms and dynamics and relationships in order to redress existing inequalities. So it's really important for us to be really interrogating programs. How do programs support men and women, girls and boys differently? And how do they take these considerations of reality into account. We have to avoid gender unequal or gender blind strategies because these ignore the importance of gender and they reinforce discrimination against men, women, and non-binary transgender people, or those who just don't conform to gender norms. So starting point is being gender responsive. A starting point of being gender responsive is being gender sensitive. Gender accommodating and gender transformative strategies are essential. And you really only get to these if you conduct a gender analysis. For example, I think one study in Kenya in 2016 showed that women with less economic and decision-making autonomy are less open to receiving indoor residual spraying because it's a cultural norm and a safety precaution that women don't permit a man to enter their house at all. So this is an important point. It's a cultural norm. It's a gender issue that programs need to take into account. And if they don't take that into account, they will not be able to achieve their outcome. These slides are quite heavy, but bear with me. That was probably the most of them. So I just wanted to give you another example of a program that goes from gender blind to transformative. So if we looked at programs just distributing condoms at health centers, just distributing male condoms at health centers and nothing else, that would be blind. Gender sensitive would be distributing male and female condoms at health centers because it implies that different people like to use different things. Gender transformative would start looking at peer-led behavior change, communication and social mobilization of women's decision-making on condom use. And a transformative and a responsive program would be community-based distribution of male and female condoms with actual training on how do you negotiate a condom use for women. So this is where we would want to be. So I also wanted to touch on this slide, which shows the differences between gender equality on the left and gender equity on the right. And I showed this to my 8-year-old son, and he got it instantly. So on the left, when we talk about gender equality, it means that you give everyone the same thing. So equal treatment of women and men in laws and policies, equal access to resources and services within families, within communities, within society at large. And you can see from this picture really clearly that even though everybody got the same thing, this little person is still no better off and not able to see anything. Whereas on this side of the picture, gender equity is more about fairness and justice and the distribution of benefits and responsibilities between women and men. And it often requires women-specific programs and policies to end existing inequalities because there has been so much gender inequality for so many generations. So this is also important in the context of the Global Fund. And in the last year or so, there's been much more of a focus around gender equity, which is often an easier conversation to have at the national level. I'm moving us on to the Global Fund. So this slide takes us back to before the new Global Fund strategy was created. And here you can see the gender equality strategy, which was how Women for Global Fund was born, because this amazing strategy that was created and just never got implemented. Then we pushed really hard for the gender equality strategy. It was also the Key Populations Action Plan and the SOGI strategy, sexual orientation and gender identities. And in the development of the new Global Fund strategy, all of these important strategies informed and now are part of the Global Fund's 2017 to 2022 strategy. And it's just really important because this year the Global Fund is commencing its new process to develop the new strategy. And so we need to make sure that gender equality remains in the new strategy because, you know, that's what the countries that's what the Global Fund will follow on from 2023 onwards. I just wanted to take you through the existing Global Fund strategy And you can see there are 4 strategic objectives: maximize impact against HIV, TB, and malaria, build resilient and sustainable systems for health, and mobilize increased resources. And then there's strategic objective 3, to promote and protect human rights and gender equality. As I mentioned before, and I'm not going to speak to all of these points, the Global Fund has really started to put a lot more focus on gender equity rather than equality. And this has been driven by sex and age disaggregated data and stronger analysis of the risks and barriers driving the disparities. Gender responsive programming is really critical to achieving program quality. And Women for Global Fund and the 3 communities and country delegations to the Global Fund board have advocated for this to be mainstreamed across the Global Fund and its investment portfolios. Adolescent girls and young women remain a priority as part of addressing age and gender-related disparities, which is here, through protecting investments in countries that are especially receiving matching funds for adolescent girls and young women. And overall, the technical review panel has in previous rounds highlighted a continued and persistent lack of funding requests that adequately and competently address gender disparities revealed in the data across portfolios. And it'll be interesting to see what the new TRP says on this. And just today, I saw something shared on that. So it's exciting to see, to have Carrie with us today to also have a little bit more about that. So in terms of priorities for malaria, this slide was taken from a Women for Global Fund webinar that was presented last year in October. So they really are focusing on increased awareness of inequality, human rights, gender-related barriers to access and use of services in relation to malaria. There's also increased appetite to conduct equity and gender and human rights related assessments. So this is, for example, this would include the malaria matchbox, and I know Olivia is going to speak to this more in a future webinar. And there's also, they're trying to increase meaningful participation of community actors and to strengthen community systems. This slide shows you these key information notes and the technical briefs, including the malaria matchbox tool. All of these are available on our malaria page on our website or the Global Fund website, and they really offer more to countries on what they should be focusing on. The malaria matchbox tool is really exciting, and it was created to illustrate the idea of a tool that could shed light on the different types of barriers that people face to access and utilize healthcare services, particularly those related to malaria prevention care, including the social, structural, financial, physical, and gender norms, which are essential to get right if you're going to get programs and services right. And then I just really wanted to flag this document for you all. It's on our website. I'll just go and tell you it's this one right here. It's number 11. It's a little bit dated. It's 2007, but it really does highlight a lot of the gender dimensions around malaria for anybody who wants to really know more. Beyond just talking about pregnant women, there's so much in terms of, the gender aspects of just looking at insecticide treatment nets and what are some of the issues around that. So I really would encourage you to go and look that up on our website. And I just wanted to pull up this slide and pull out the recommendations from the new Malaria Network, Civil Society for Malaria Elimination. These were their recommendations on Malaria World Day. And this one in red was particularly calling out to guarantee human rights, gender sensitivity, and the dignity of communities in the defining of policies and strategies and implementation of malaria control and elimination interventions. So again, just coming back to the slide, we've pulled together what we think are the most key documents that you should be looking at in terms of malaria and gender. And it's available on our website. So thank you very much for listening. Olivia, I'll stop there.
Okay, thank you very much. Thank you, Sophie. We thank you for your presentations. So everyone, if you have questions, please write them in the Q&A box on your screen. So we're going to do the Q&A sessions at the end of all the presentation. So thank you very, very much, Sophie. We had a lot of message on the chat of people saying that they really love the slides and the diagram and the explanation. So thank you for the time that you took to prepare this presentation. Thank you. So next we have our TRP members, Katya and Kerry. So Katya, we'll start with you. Thank you.
Okay, great. Thank you so much. And I think you'll control the slides, right? I'll just say when to change the slide over.
Yes.
Yeah, thanks so much. So just to start off a little bit about myself and Carrie. So I was on the TRP between 2012 and 2017, and I'm actually serving this year as an old member, just supporting the onboarding of new members and participating like a regular TRP member and a focal point for human rights and gender. And if you look on the TRP website, you will see that there are different groups within the TRP, and human rights and gender is one of those groups. And you can click on the link and you can see who the human rights and gender experts are on the TRP, and you'll see Carrie listed there, but not me because I'm a former member technically. And I was the person who started that group some years ago, and on the TRP, and led that group until until my term finished in 2017. And now we are so fortunate on the TRP to have a really wonderful, strong group of TRP members who are human rights and gender experts. And Carrie in particular has an expertise in malaria as well. So we're just delighted to have her on this webinar and on the TRP. So to start off, I just wanted to point out that, and as you all know, malaria and gender is a pretty new field, and there's no guide to best practices of what human rights and gender in malaria is. And so what we're going to do here, Carrie and I, is talk a little bit about some concrete examples about what gender interventions in malaria might be. And I'd like to start off by just pointing out some of these resources. In addition to the resource that was mentioned in the last presentation, there's this one, which was shown in the last presentation, the technical brief on malaria, gender, and human rights. UNDP also has a discussion paper on gender and malaria, which actually I wrote. And UNDP put that out in 2015. It has some useful things, I think. USAID also did a gender analysis of malaria programs in Uganda in 2017. If you Google it, you'll see it. And also we can provide the link. It's one of the best ones that I've seen. And finally, most recently, the Gates Foundation has put out a paper that was written by a center at Stanford University on gender and malaria. The slide went faster than I thought. Sorry, what was the previous slide? Anyway, okay, so the Gates Foundation has commissioned that paper, and you can also find that, and we can provide the link. And so these are quite useful resources. And finally, I just wanted to point out in the beginning here that gender in malaria is a new thing for malaria experts. And malaria is often a fairly new field for those of us in civil society who have been working on community human rights and gender. So there's a real opportunity, I think, here for cross-fertilization, to listen to each other and to understand what the issues are in malaria. This is really important point, I think, so that we can understand how gender plays out in malaria and how that may be different from the way it plays out in HIV, for example, because many of us who've been working on these areas have been working in the HIV field. So that is the point I wanted to make. And the next slide, Carrie and I are sharing. So the next slide is going to be presented by Carrie. Thank you.
Yeah, no, thanks, Katya. So building really from Sophie's presentation is that you know, in the world of malaria, there's typically a lot of language and sort of framing of access around the concept of universal access. You know, we achieve a broad coverage of whatever intervention that's in question, be it net distribution, you know, CHWs with community-based testing and treatment. But this is something that I think the Global Fund in particular and a lot of groups are really looking at how can we do better? You know, and this is where we get at the notion of equity in terms of coverage, in terms of what is the user experience? You know, how do we bring the lens of the woman, of the adolescent girl sort of back to the forefront of the programming and make sure that's clearly captured, not only in strategies, but operational plans. So a lot of the malaria work that's funded by Global Fund, you know, involves community-based testing and treatment as one example. Which is great, but how do we make sure and how are programs ensuring that that service that's available at community level still addresses all the barriers that a woman might face? You know, are women comfortable to approach a man for, you know, if the service is based in his home? How do we ensure that the adolescent girls who may have to answer questions around a potential pregnancy feel comfortable and supported to go to a healthcare worker to be able to receive that service? You know, just using this as a frame going forward and thinking about, do we see any, you know, I would encourage everyone in their programs to think about how do we see issues in treatment seeking behavior? Are there any gender specifics there? Do women delay bringing, you know, a girl child or you know, versus a male child to a health worker? Do we see any sort of changes in treatment adherence? Do mothers or women tend to hold back on their own treatment in hopes that they might be able to give their malaria medication one day to their children? These are just some thoughts to build on as we go forward. And so I think we might, Katya, back to you.
Yes, so we're not on the correct slide here. So the slide that Carrie was presenting is 2 slides before this one. We need to go back. Okay, this is the slide that Carrie was presenting. Excellent. Okay, now the next slide, please, is improving data. Great. So I'll present this. This is a pretty simple concept. One of the first things that any of us will find if you start working on gender or human rights in the context of malaria is a dearth of data, including a lack of gender disaggregated data at the national level. And this is a real challenge. It's not just a country challenge, it's also a multilateral UN level challenge that data is not there in a number of areas. And so that is something that we all need to be aware of. So regular national data systems will collect sex disaggregated data at the facility level, but once it gets aggregated, it's lost. And there are some ways that this can be addressed. For example, looking at surveys, those can be gender disaggregated. Qualitative studies can also gather that type of data. But this is a challenge that all of us will face. And if you're, when thinking about the concept notes over the years, I think that there's been a real progression in terms of presenting data on gender and malaria and also sex disaggregated data. There is a lot of progress in that area. So that is something that you might want to think about as you're developing your concept notes, your funding requests. Is that data there? If it's not there, what are you going to do to collect it? Thanks so much. Let's go to the next slide, please. I believe it's Carrie.
Yeah. So thinking about 2 core components of sort of every malaria program in vector control, you know, bed net distribution, LLIN distribution, and indoor spraying. So often we see that, you know, net distribution, again, gets described very much as a logistical process of, you know, we have these steps, we achieve this amount of coverage. And there's a lot of missed opportunity in this to really engage women within this process and create that participatory process, which ideally gets you and the program a little further along that gender continuum of from gender aware to sort of being more gender transformative. There have been some good examples where, you know, also to ensure that universal coverage, that women are brought in to really perform a check, either at the planning, sort of the mapping stage at the village level, or, you know, afterwards at verification stage, where women really get to sort of come in and say, well, you know, these nets reached, but there were a lot of either households that were women-led were not reached. We did not receive enough to sort of cover the members in our household, particularly the female members in our household. And similarly with IRS, you know, Sophie had the great example of making sure that when you're planning for IRS, that women and decision makers in the household are sufficiently aware about what's to happen, so that, you know, there's a higher acceptance rate of the IRS program. Next slide, please.
Okay, next slide is me. And listen, just for the civil society people who may not have worked a lot in malaria before, IRS is indoor residual spraying, and LLIN's long-lasting insecticide-treated nets. So just to make sure everybody's on the same page. Okay, so this is a slide about some examples of gender and malaria interventions. And as Carrie and I have pointed out, there is not yet a compendium of good practice gender interventions for malaria in the way that there is for HIV, or the way even that there is in TB, because this has really been developing a lot faster in TB than in Thank you. So here are a few things that you can do. One is to conduct a gender analysis. Now, those of you who've been working in HIV and TB will know that there is a gender analysis tool, several gender analysis tools for HIV, and there is also one for TB that has been put out by the Stop TB Partnership, but we don't have a set tool for malaria gender analysis yet, but I hope we will soon, but there is not one yet. However, that being said, some countries, this example is actually from a country that's just coming through this year with a Global Fund funding request. So since it hasn't been formally approved, I've just taken out the names of the countries, but this is a country in Africa that did conduct a gender assessment of malaria programs in their country, and it looked at understanding gender barriers to access the long-lasting insecticide-treated nets for women, men, adolescent girls, and boys, as well as some intersectional issues looking at education and geographic location. This was not the malaria matchbox tool that this country used, but the malaria matchbox tool is a tool that you can use, although as you'll be looking at later, it is not focused only on gender. So that is one intervention that could be put into funding requests, and that is often put into funding requests, especially using the malaria matchbox. Another thing to think about is integrating gender considerations when you're looking at particularly vulnerable groups in malaria. And in malaria, there are some well-delineated vulnerable groups. These are some examples. Male mobile forest workers is one. And this example actually is from several years ago, and the country was Cambodia, as I recall, and this did go through. So, I'm naming the country. So they had identified the mobile forest workers as a particularly vulnerable group because they're sleeping out in the forest and so exposed to mosquito bites. And what this country proposed to do was to include malaria services for the wives and children of the mobile forest workers, because upon doing an assessment of the vulnerability of those male forest workers, they found that increasingly families were accompanying them. So this is one example of integrating some kind of gender considerations into a malaria intervention. Next slide, please. Here are a few other points. Using gender-sensitive communication to reach women. So this was another country that had done some gender assessment of their malaria program, and they found that the female-headed households were not absorbing information about malaria risks, malaria prevention, and access to malaria treatment in the same way as the male-headed households were. And what they realized was that the female-headed households were not accessing the written messaging that was made available from the malaria program. However, they found that the female-headed households were engaged in community groups, and therefore they decided to utilize those existing community groups to communicate malaria messaging specifically for the female-headed households, because those households were becoming the most vulnerable to malaria since they weren't accessing the necessary information. A similar approach is to work with those existing communication methodologies, such as girls and boys clubs in school and youth clubs for out of school youth. This was another intervention. They used a participatory theater, which is something that is often done in HIV and can be also used for malaria. This was to raise awareness about gender inequalities and to link vulnerability to malaria or information on malaria prevention and control into those participatory theater activities. Next slide, please. I think this is also my slide. Yes, okay. Here are a couple of other interventions that we've seen over the years. Just to remember that gender means both men and women, so that you might look at gender-specific interventions that are for men. And here are some examples. I already mentioned the mobile forest workers in Cambodia, but here are some examples that countries put in specifically for men to address the particular vulnerabilities they may have associated with their work. So one was providing long-lasting insecticide-treated hammocks for the forest workers, male forest workers. Also in refugee camps, this is more sort of a key population, not a gender intervention per se, but insecticide-treated clothing and insecticide-treated bedding in places where it may not be feasible to provide nets. And here is a second example for this slide, engaging men for women's empowerment. So quite a few countries have worked on this. And this is one project which was published actually in the Gambia, Raising Women's Voices on Malaria. It was funded by the Swedish International Development Cooperation Agency. And it worked with peer educators to use short dramas and community focus group discussions geared towards showing male household heads the critical role they can play to support women to go for IPTP, to access the insecticide treated nets, and for other malaria control measures. And this is also an intervention that has been used in HIV and also a lot in TB, to work with male family members in order to support them to support female family members to access the types of services that they need. Next slide, please. Okay, this is mine. Okay, so integrated community case management, ICCM, integrated community case management. This was a study that was supported by PMI from USAID in Uganda. I believe actually I referenced this, this assessment on the first slide. And they found that ICCM was particularly effective for ensuring that women can get timely access to malaria services. And I believe Carrie is going to talk a little bit more about ICCM in a later slide and how it can help women to access services if it's done correctly. So I'm just going to leave this point because I know Carrie's going to follow up on it. Another intervention that's useful to consider for your funding requests is simply training on gender for service providers, including community health workers, to ensure that they are appropriately trained on gender-specific issues, especially related to pregnancy and malaria. And this is also something that Carrie's going to speak on in the next slide. Next slide, please.
Yeah, no, thanks, Katya.
Yeah.
So pregnancy and malaria and treatment for pregnant women. This is, I would say, one of the biggest gaps that we see in some of the most recent funding requests. I think it's a well-acknowledged fact that most countries, there's a real struggle to obtain optimal levels of ANC coverage for 3 or 4 visits, depending upon national strategy. And this is really a place that we look to see, have programs unpacked all of the barriers and looking at, why are women coming, which type of women are coming at what stage. This is one indicator that I believe is almost always required. So there's often a lot of questions that are raised around this. And we would expect to see countries that, okay, where there is a sort of a better or above average, uptake of ANC, what about IPTP? Is there, what's happening if the coverage is quite low or the uptake is low at various visits? Is there a need to go in and train healthcare workers, as Katya said? There's a lot of work around gender that can be done to really help improve those numbers. And again, this is a place where countries where there's high adolescent pregnancy rates, it would be good to sort of illustrate within the funding request how these, how the ANC programs are looking to sort of get younger women into service, as well as to make sure they're using, the IPT service. So it's something to really delve into and to make sure that when you're presenting data, there are a few applications that came in and presented, ANC cover, sort of the uptake of IPTP and of the total number of women who came. We really look to see where do women, what is the total overall uptake? There are also a few countries that have pushed out a bit and are now starting to provide the service at community level. There's a program that's been sponsored by UnitAid called Tip Top that has some interesting learnings. I believe Japaigo is leading that, but it's a sort of a well-documented example of some efforts that have gone into this. And back to Katya.
Hi, yeah, the last slide, please. Okay, so this just goes back to what we were talking about in the beginning, the nascent nature of this field, the lack of a compendium of good practices on gender and malaria. So what we'd like to encourage everybody to think about is one, I guess, is actually the second point here, to utilize the existing resources. There are resources, the number of resources are growing. The very fact that we have this webinar shows the increased interest in gender and malaria. And in terms of developing your funding requests, of course, the Global Fund Malaria, Gender and Human Rights Technical Brief is the main thing you'd want to look at, but there are other sources as well. And that technical brief, when you read it, you'll see that there are not a huge number of examples of good practices. So I encourage you to look at the available resources. Second, once you start collecting data, so gender assessment will be one of the critical interventions that you'll want to consider doing early on. Once you start collecting the data, because there aren't a huge number of good practice or set interventions, this is really an opportunity for all of us to think about developing your own. Think about what the data is and propose something, some intervention on the basis of that data. And this is a gap that we've seen a lot, both in gender assessment in general, in the Global Fund funding requests as well, and also in HIV and TB, is that people do a really great gender analysis. They identify what the vulnerabilities are and the gaps, but then when it comes to programming, it's not really developed. So think about something that you can propose for yourself, something concrete. It can be based on the available information, but because that information is not very developed yet, don't be shy, just go ahead and develop something of your own. And the third thing is, please share with others. I think it would be great if there was a platform, I don't know what there is right now, but I could suggest a platform to share what works, because this is a growing field and we all need to know. So I think this is the end of our presentation. And I hope that we can provide some resources afterwards, and also contact information for myself and Carrie in case anybody wants to reach out. Thank you so much.
Thank you very much. Sorry. Thank you very much, Katya and Carrie. We actually love the presentation. Thank you for all the information that you share with the participants. We appreciate that. Everyone, please, you can continue to ask your questions on the Q&A box. So we will do the question and answer session at the end. And we hope that you were like us, able to learn a lot from Katya and Carrie. And thank you again for sharing your experience on the TRP. It's very important this year, when we know that many countries are writing their malaria concept notes, and they have a higher increase of budget for the malaria concept notes. So we need to make sure that there's a strong component on gender programming, as well as community rights issues on those programs. So next, we're going to talk about how civil society and community can be engaged in this process to make sure that we have malaria programs that are gender transformative and that are gender sensitive. So I'm very happy next to to introduce Olive, our last presenter of the day. And Olive Mumba, please go ahead. Thank you.
Thank you very much, Olivia. As introduced, I'm Olive Mumba, based in Arusha, Tanzania. Can I have the next slide, please? I'll be moving very fast. I have very few slides, so it will only take me some few minutes. I think this is just about Yanaso. Can we have the next slide, please? Yeah, the next slide. So just to take forward the discussion on what the Global Fund in terms of the strategy has talked about of integrating gender and human rights, but also Katja and Kerry took us through this in terms of looking at opportunities of how malaria can be, gender can be integrated in malaria programs at national level. So I wanted us to just quickly go through, let me just, I need to hide this. I just wanted us to look at what opportunities exist in terms of at the Global Fund level. They have what is called the Community Rights and Gender Strategic Initiative. It ran through 2017 and it's up to now currently running. So there's been an extension for 1 year, so it's up to 2020. But as of November 2016, when they were doing the allocation of how much money should go into specific initiatives, 15 million was allocated to the Community Rights and Gender Strategic Initiative. It is a department within the Global Fund Secretariat itself. So you will see that in terms of how that funding is being utilized, there are 3 components. One component is the short-term technical assistance program. This supports in terms of civil society and communities, and including malaria communities, to tap on and get support. This can be through a consultant. It can be through consultations. It can be assessments you would want to, some of them Katja and Kari took us through. So you would want to get info that civil society and community, malaria civil society and communities are able to engage in the national processes. And these processes start from, my internet connection is quite poor. So can I just switch off my video so that I can retain my connectivity? So this means that technical support can be taken from the development of the national strategic plan up to the point to utilize that information to inform the national strategy, identify what are the priorities as civil society and communities, and then when the country fund request development process is happening, you are also able to hold consultations, bring your information. You've already identified your priorities, but also hold, you know, in terms of your own consultative meetings, apart from the national dialogue processes that will be happening. The technical support also goes on into the implementation, just basic in terms of things like development of community-based monitoring systems, where you're able to monitor how funding is being utilized, or how services are being, the service uptake is being taken. So the second component, which is a longer term capacity development of key and vulnerable populations, this, the Global Fund has identified specific numbers of networks. These are global KP networks, and which have national or sub-regional networks. And these can be like networks of sex workers, networks of people who use drugs, networks of adolescent girls and young women, the global network of people living with HIV, TB people, and also I think malaria through Impact Sante is also one of the networks that is supported by the Global Fund. The third component are the regional platforms for communication and coordination. These are 6 platforms. I think we'll talk more about that a bit later. But this why the Global Fund came up with this idea is to ensure that we should not just be talking about how to integrate gender into malaria. And we should not just talk about the programs, but making it a bit more practical so that civil society have that opportunity to tap on into these three components and increase the engagement in various national, regional processes that relate to the Global Fund. And if you can see down there, the impacts of this CRG-SI are threefold. And I think one is to strengthen the meaningful engagement of communities in Global Fund related processes across all stages of the funding cycle, but also to reflect civil society and communities' priorities in their funding requests, in transition planning and related national strategies. I would like to mention that in some countries, there are transition plans where the Global Fund is currently living, and it's not every country, not all at once. And I think that this is where now the Global Fund comes in to make sure as the Global Fund transitions, communities are not left and programs that have been running are not left just standing there. Also, the greater emphasis on evidence-informed and rights-based programming. Also that there's access to technical support, identifying what those needs are and how those needs can be provided, but also strengthening the community's capacity to design and deliver quality technical support. Can I have the next slide, please? As we move on to the next slide, it talks more around the civil meaningful engagement. I think it just reiterates what I've already talked about. So it's just around the three areas. The next slide, please. The next slide will be talking more around the CRG, that's Community Rights and Gender Technical Assistance. What this short-term technical assistance does is it tries to respond to civil society, and it takes around 4 to 6 weeks in terms of for it to be deployed. There is a very short form which is online. You can get that or either on the Global Fund website, or you can reach out to Olivia, who has linkages to the platforms. I think in Africa we have 3 platforms, but we also have other platforms. So those platforms will have that form. They will support you in terms of filling in, or even Olivia can support you in filling in those forms. And then once it's completed, you submit it to the CRG department, and then they will quickly review. And if they have questions, or if they see that it qualifies or doesn't qualify, you get a response. If it qualifies, then they will move forward to helping you in developing the terms of references. And these terms of references, they will also now start looking at what are the key activities, the number of days. So you develop a work plan and a small budget. And then also they'll identify who the TA provider is. They have a pre-listed technical support providers who are civil society, as such, know how to respond to some of the issues that we as civil society and communities face. And then they will identify through that service provider a technical consultant who come and work with that organization. Then that means that they will deploy that technical assistance, and within that they have specific time whereby, if it's more, I think the maximum is 40 days. So when you get the short-term technical assistance, it cannot go beyond 40 days. So in the past, the TA would come and preferably most of the times they look at someone who comes from the region, if not from the country, but from the region, who is able to support that TA, but they'll also link the qualities in terms of the specific competencies of that specific assignment. Once that work is done, then there will be a report on the TA, and they will also develop a case study, which will now will form lessons learned for future refinement of such TA. So that is around the CRG TA. If we can move on forward. Next slide, please. Thank you so much. So I talked about the 6 platforms. These are the list of the 6 platforms. For more information, please contact Olivia. I think we'll be able to give you more information. IANASO is the Anglophone Africa, and we cover 25 countries in Africa. And each of these countries also have, depending on the area of coverage, they also have specific languages, specific needs, and the contexts are quite different. And that's why we have been divided into 6 platforms. Next slide, please. In terms of the 6 platforms, they are guided by 4 objectives. I think I've put only 2, unfortunately, but I'll go through the 4 of them. The very first one is around knowledge creation, and this comes through communication, making sure that there's adequate information flow, both from the community level going to the global level, to inform policies and programming, but also from the global level coming down to the community level, such that if, communities are able to have knowledge and information that they can use as they engage in country processes that relate to the Global Fund. The second one is around engagement in various national processes. These I mentioned can be around the national development of the national strategic plans. This can be during the fund request development processes. It can also be as civil society or community representatives on the country coordinating mechanisms, CCMs, but also engagement during implementation. We know that some of our civil society are implementers at country level. They can be either PRs, principal recipients, or can be sub-recipients or sub-sub recipients, but also engagement as community-based monitors, meaning looking at how services are being monitored, whether there are issues, barriers, and how those barriers can be solved. So engagement at various levels. So, and then the third one is around technical support. And when we talk about technical support, it means that as a platform, you are able to link civil society and communities to the CRG, the Community Rights and Gender technical support. But at times there are other partners that are out there that also provide technical support. So it's around looking at what are the needs of civil society, but also identifying who are the providers and creating those linkages. But during this process, you also carry out how that technical support is being provided, whether it's meaningful, whether it's effective, what type of technical support is there, what type of sub-technical support is missing. So there's a lot of assessments that are also carried out to ensure that whatever linkages to technical support is meaningful and that no communities are being left out. The fourth area is around strategic areas where any platform identifies that they may need to work more on. I'll give an example like our colleagues in Latin America, where they talk about transition. And then also on our side here in most of Anglophone Africa, where we're also talking around, I'll give an example of, which area can I talk about? Let me say around social contracting, which is quite new and something that is not really known, and making sure that civil society get to know about it, and then they also have that experience and we can share more information around that. So those are some of the 4 areas of the objectives of the platforms. Olivia had told me to just quickly talk about COVID, so I'm going to run through these slides. So there was a survey that was conducted. Next slide, please. Looking at the needs of HIV, TB, and malaria communities in the face of COVID. What is the current situation in terms of, is there service disruption? how civil society and communities are engaging in the country processes, including the country dialogue processes, but are they also engaging in the COVID national responses? And then what are some of the human rights and gender-based violations related to COVID? I just took some few slides, so I'm just going to give a highlight, not go in depth. Next slide, please. We had about 100 respondents, participants, and out of that, as you can see, we had 25% coming from the HIV sector, around 24 from TB, and for malaria, we had 12%. We need to say that we really would want to encourage malaria civil society and communities to be able to engage more. And we're happy that at least Olivia now is coming up and will be the link towards increasing and supporting the engagement of malaria communities in Global Fund processes. Next slide, please. So as you see, around 12% of the respondents came from the malaria. So whatever we are looking at here takes into consideration that it's wider than just malaria. It's other aspects as well. So some of the questions that we got was, have you been engaged in reprogramming of Global Fund grants? It's important to note that Global Fund has provided 2 streams of funding towards COVID at country level. One is a flexibility, which they look at supporting from the current grant up to 5% from savings and another 5% from flexibilities. And and then the second one is a grant which comes up to around $10 million US, also looking in terms of, it's called COVID-19 response mechanism. So with that, we wanted to know whether civil society and communities are engaged in this reprogramming of these grants that are coming in specifically to respond to COVID. And majority of the respondents from the communities have not been involved in the reprogramming. As you can see, 49%, 49, which was at 53%. Next slide, please. And we proceeded on asking some more questions. If they are aware how the country is utilizing the COVID funding, and majority said that they were not aware, which you can see by the 49%. So for me, it asked the question, as malaria constituency, civil society and communities, how are we engaging in such things? Because funding is coming to our countries and we are not really engaged and we don't know how funding is being utilized. So this all talks about the key, why it is key for us to be able to know what is happening. Kaja and Kari took us through how countries are developing in terms of the programs. Yes, they're developed, but then after the funding comes, how are we engaging? So this is just an example of how we are engaging. Next slide, please. So in terms of engagement within the COVID response, next slide, please. I will not go into details, but we asked the question, how has COVID affected your daily programmatic operations? Majority respondents said that they have been greatly affected. You can see 55%. And they came up with how they were affected. I think we'll share the slides. I'll not go into those. The next slide, please. And then the next question, one of the questions was, whether they were civil society and communities were part of the country task force team. Majority they said yes, around 35% said yes. But shocking was that 36.5% didn't know. And this talks about the country processes that are happening and that we are not, if we are not informed, it will be very difficult for us to make sure that community rights and gender, community system strengthening, human rights and gender is integrated in these programs. And that is why when we do not know, we cannot, once we don't have the information, we cannot be part of the process. So it's key for us to seek information, to seek technical support for us to engage in such processes. And then next slide, please. So in terms of, one of the questions was what type of information or guidances or policies that communities and civil society would want from the Global Fund. And we had an array of different types of responses. Some wanted standard operating procedures for civil society, how to engage during COVID-19. Some wanted basic guidelines, engagement guidelines, so there was a lot of requests for various types of guidelines. But for me, I think the guidelines can be developed, but what we really, I would like to encourage you is to seek out what is happening at country level and seek out where are the opportunities. And once you know the opportunities, reach out, Olivia, reach out and say, we want to engage, but we do not know how to engage. And then together we will develop a plan of how to get you to be engaged in these processes. Olivia, if I'm not mistaken, this was my last slide. Next slide, please. Yes, so in case you need to get in touch with anyone from the Anglophone Africa platform, you can get in touch with Mlewa Onesmus Kalama, who is coordinating the Anglophone Africa platform. There's also Yvonne Kahimbura, who is also supporting Glory Chagama and Roderick Mukishagwe. Any of this team, at any time, you can write an email to us, yanaso@yanaso.org, and also link up with Olivia. I would like to thank you and hand over the mic back to you, Olivia. Thank you.
Thank you. Sorry. Thank you very much. Thank you, Olive, for the presentation. And as we can see, there are technical assistance available for civil society and community to be able to integrate more community rights and gender issues and malaria. So thank you very much, Olive, and also for the quick report about the impact of COVID-19 that you have realized, because we know that it's going to have an impact on malaria programs, especially gender. So thank you very much for that presentation. So next last thing, so we are actually at the end of our webinar. So we have a few questions in the Q&A session. So my dear panelists, ladies, if you would like to start your videos, and we will try to answer some of the questions, and Sophie has already started to answer them on the Q&A session that everyone can see. So there's a question about, is there any plan to support civil society financially to implement Global Fund strategy, especially in advocacy, increasing access to NET and also anteprenatal care services in how to reach an endemic communities. So Katya and Kerry, I don't know if, or Sophie, I don't know, or Olive actually, because it's a general question. I don't know if any of you would like to answer that. So that's the first question. Is there any plan to support civil society financially to implement those Global Fund strategies? So the second question is there a mapping of how much technical assistance is given around CRG for malaria specifically? So do we have a mapping of technical assistance for CRG for malaria? And if so, how successful this has been? I think, Olive, you just spoke about technical assistance for CRG around HIV, TB, and malaria. So if you like to take that questions on, please. So third questions, how Global Fund ensure that civil society engage and participates in the fund, to the fund and support countries. Example with COVID-19 or other accountability issues, and how to actually follow up and support the CSOs. I think this is from Tanzania, and it's very much similar to the first questions about any support civil society can receive to implement those Global Fund strategy. And so there was questions that Sophie has answered in the Q&A session, which was implementing policies like making HIV, hepatitis or malaria testing a routine as part as the antenatal care sounds beneficial to women. So how is that exploitative if the outcomes are beneficial? Yes, so ladies, I don't know, Katja, Carrie, Sophie, if you guys want to take a turn to try to give your response to some of those questions. So Katja, we can start with you maybe.
Okay, about is there any plan to support civil society, etc.? I mean, civil society in malaria is already supported by Global Fund grants in a number of countries. So not only is there a plan, but I mean, as part of regular Global Fund processes, like any like civil society organizations in any of the other diseases, so can civil society organizations working in malaria be supported by the Global Fund. So yes. And then the mapping question, I don't know where it went, but is there a mapping of TA and CRG for malaria? As far as I know, no, I don't think there is. It would be useful, but no. In fact, in general, there's not much mapping on TA. I think that's the only questions I could address. Carrie?
Yeah, no, I think you covered it. I mean, I would just add that, you know, support for civil society working in, you know, human rights in malaria. I mean, in any intervention that sort of directly speaks to any gaps or vulnerabilities, like work with the country program to make sure that's included, and that's the easiest way to get it funded. There are a lot of applications in a lot of countries that, you know, include specific budget for small civil society organizations to play a role. Hope that's helpful.
Yes, Sophie, go ahead.
Just to answer the question around, you know, what do you do if you don't know what's being programmed around COVID, or you're not sure what's happening? So I would advise that you keep requesting that information from the CCM, from the country coordinating mechanism, and the civil society who represent civil society on the CCM and people living with HIV in communities. And if you have no luck there and you're not getting any answers, then I would go to the delegations, the communities delegation, or the developing NGO country delegation, and flag with them. So on a webinar with us a week ago, time is a bit fluid to me right now, but very recently, you know, the country NGO country delegations were saying that if there are issues with how things are moving along at the national level, that they should be flagged with the delegations. So I think, Olivia, if you could also put those details up as we share the notes and the presentations, then I think, you know, that's also a good starting point. You could also reach out to us and we could connect you as Women for Global Fund and see how we could support. In terms of the mapping of TA, I do think that information exists. We just have to ask the CRG department for it. And it would also be really good for us to know how much TA is going towards malaria, but I'm sure that information exists. Yeah. In terms of the programming around, you know, whether things are exploitative or not, and that, you know, when I talk about that in various platforms, there always seems to be quite a strong reaction because it is quite a thing to say. But I think ultimately we need all programs, services to, as a minimum benchmark, to respect rights. And sometimes the way things get rolled out at a national level come from more a public health perspective and not a human rights perspective. And so people are tested when they don't necessarily want to be tested. People are tested without knowing that they're being tested. And, you know, people need to be able to be ready to digest an HIV diagnosis, ready to start treatment, especially if they haven't felt sick. So there's lots of things that I think we need to factor in how we exploit opportunities and ask ourselves who those opportunities are actually benefiting. I think that's right. I just wanted to say, I really agree with Katia and the points Carrie also raised. This is a really new area of working. And if I had had more, gender transformative programs on malaria to share, I would have shared them. So I think we need to keep talking, brainstorming, and keep advocating for that compendium, because we really do need it right now. Thank you.
Okay. I just want to clarify real quick about the mapping in TA. So the CRG department in the Global Fund has done very minimal TA on malaria and gender. In fact, I'm not aware of any they've done. Except I did a malaria and gender review for them. And so did another consultant who I'm aware of. But so mapping would cover all the possible partners who would fund malaria and gender, including USAID or the French 5%, et cetera. And that mapping hasn't been done. However, whatever small TA supported malaria and gender, if any, has been done by the CRG department, sure, they'll be aware of that. Just to clarify. Thanks.
Yeah, thank you so much. That's Katia for clarifying that. Within the CRG department, they have a tracker, and most of the times the tracker will be talking around TA that has been deployed. And that of course, they also say that which has been successful, not successful, which has been deployed, which has been completed. So it gives you an update as to what level of TA there is. And as you are rightly saying, the TA, especially when it comes to malaria, the demand is very low. And because of low demand, I have to mention this because I predominantly worked in HIV, and there's been a lot of mobilization around the knowledge of advocacy, knowledge around engagement for a longer time in HIV when you compare to TB and malaria. And that has also, that has also influenced in terms of the interests to engage in various processes. And as we are seeing, TB and malaria are now also coming up, and we are seeing that even as we move forward, whoever thought that would be having such type of a webinar where we're talking about malaria and gender, so everything has a beginning. The numbers may be low right now, but it also represents the how civil society, how much information is trickling to communities and civil society in malaria. And I think we need to improve that. And as more information gets there, the more engagement there's going to be, more opportunities are going to come up, more spaces are going to open up, and more demand for TA is going to come up. So the more we get to coordinate civil society, especially around malaria, I think we'll be able to understand more of these things. And that is why I think, Jessica, you asked around whether there's that mapping or whether the TA that is there is successful. I think that is a good question that probably the CRG department plus the platforms should look into. And Kaja, you're very right that TA is beyond the CRG TA. There are other TA providers and partners that support civil society. There was a question specifically from Timanywa Kachocho asking about financial support to malaria civil society. I think in terms of advocacy, increasing access to services in hard to reach areas. As the Global Fund develops the fund request, that is the place where we should start to engage. When, not even by that time, I think we should start to engage when our national programs are developing their national strategies. When they develop those strategies, if we are there, we are able to include what the community needs are, and also identify who is going to participate in what. When the fund request development process or other programming is coming at country level, If we are engaged, therefore, we are able to also make sure we include some of the activities that will be implemented by civil society and communities. And it's very key because our governments will not be able to reach those hard to reach areas. It is us as civil society and communities that know where, there's a saying in my language that he who wears the shoes know where it pinches most. So us as civil society and communities, we know which areas require that support most. And if we are there, therefore we are able to implement. But if we are not within the table, on the table as decisions are being made, then it becomes quite hard. And Sophie talked about our representatives on the country coordinating mechanisms. Those are our entry points to these processes. And this team, whether it's someone representing women, someone representing the key populations, because we know that in some countries there are no malaria representatives. It's malaria sometimes is given to broad representation. So we need to know who is representing civil society and communities and how can they carry our agenda. When processes are starting, where are we? So I wanted to respond to that. I think I leave it there. Thank you so much. Back to you, Olivia.
Thank you. Next slide. Thank you very much. Thank you, Olive. We are actually reaching the end of our webinar. So we hope that this was a very interesting webinar for all of you. We still have a lot of questions in the Q&A. We're going to write them down and we're actually going to answer them in our next webinar, which will be on July 1st at 2 p.m. UTC time. And we're going to go in depth and introduce you the malaria matchbox. So it's the first tool that was presented by Sophie in her presentation. So we're going to go in depth and present that to you. We will be happy to also have the Global Fund with you to talk about that tool. And we are going to have also Mrs. Jessica Rockwood. She's also a gender in malaria, and she will talk about some of the lesson learned and some of the key advices for malaria programs. So how to address gender, human rights issues in Global Fund malaria program. So we're going to continue this conversation on July 1st. And so there was a very interesting question about, is the Global Fund going to start designating data by sex, not just for pregnant women, but also starting to push for this disaggregated data by sex. I think we're going to also invite WHO on that webinar so we can have that discussions with civil society, communities, countries, and everybody, and all the malaria actors. So thank you so much. Thank you very much to the panelists. I don't know if you can hear me. Check my hand. So thank you very much. Thank you. It was a very successful question. We also had many people on Facebook following the presentations. So all the slides are going to be available. So all the slides are going to be available on the website, Impact Santé Afrique, impactsante.org. So we're going to share that link with you by email, so you have the presentation and you also have the contacts of all the panelists if you want to get in touch with them directly. But thank you so much. Thank you, Sophie. Thank you, Katja. Thank you, Carrie. Thank you, Olive. And please, if you are online and you want to have your video on, we're going to take our family pictures before we leave, since we can't do it in person anymore. But thank you so much. Thank you to everyone who joined us today. We appreciate your time. Okay.
Bye. Thank you.
Thank you.
Bye.
Thanks.
Okay. So Katja, and are you still here? No. Okay, perfect. Thank you, ladies. Have a good night. Thank you.
We're done, right? Are we done?
Yes, we're done. Thank you.
What about the family picture?
Oh yes, maybe. Oh, I thought you guys were gone. So Carrie, are you here? And Olive?
Yeah, I'm here. Oh, I thought you already took it. I'm sorry.
Yeah, I'm so confused.
Yes, I don't know if Olive is here, but
Maybe we should take a picture with like all the participants, but I guess it's too late now.
no, it's not even possible to have everyone on video. Okay, great. Carrie, are you here?
Yeah, Carrie's here.
Yes, Olive. Olive encore là? So I think Olive left. But okay, it's okay. We'll do it next time. But thank you, ladies. We appreciate your time. Thank you so much.
Olivia, can I just ask you something? I just wanted to ask you about the French one. You'll be able to send me the revised PowerPoint tomorrow? I mean, not the revised,
Yes,
translated.
I'll send it to you tonight.
Oh, thank you so much. Okay.
Tonight. Thank you.
Okay.
Thank you. Have a great evening. Thank you.
Okay, bye.